So today I'm going to discuss your home program with you. I am going to recommend that you use a at-home TENS unit, which you can purchase from Amazon for about $35 to $45. Since you do have that pain in your low back centered around your paraspinals that has been unexplained and occurring for the past 5 years, I am going to recommend that you use this TENS unit because it should help to alleviate some of this pain and reduce the need for medication. So my rationale for prescribing you this is to assist with your pain through what's called the gating system. Therefore, this unit can help in a way that is comfortable and it will offer that rapid pain relief. The benefits to this include a safe, non-invasive, and non-pharmacological pain relief. Although there are some risks, they're not very big risks, so that can include the small chance of a burn occurring under the skin, although this is highly unlikely because the charges are balanced on this unit. And I also want to go through some contraindications, some reasons why we should not use this on you. So I want to make sure that you don't have any of these things before you use this. So that's going to include having good sensation on your low back area, which your physical therapist, me, I would have already assessed that for you. I want to make sure you don't have any active cancer or that you are currently pregnant. I want to ensure that you don't have a pacemaker or an active bone infection, no metal implants or blood clots. I want to make sure you're also not actively bleeding over that area, and that there's not a phrenic or urinary bladder stimulator. And I just want to remind you that you should not use this over your eyes or the the front of your neck here. Before I get started on my demonstration, I wanted to go through some adverse events that may occur. Like I said, a risk is that there could be a burn, although it is unlikely. I just want to make sure that after each use, you inspect your skin or have someone inspect that low back skin where the electrodes are placed to ensure that there's no redness. And if there is redness, please discontinue use and let me know. I'm going to go through the procedure of getting your TENS unit set up. So first I want you to take an alcohol pad and make sure you clean the area where the electrodes are going to go. You're just cleaning that low back area where you're feeling that pain. And next, we're going to wait for that to dry. And once that's dry, we're going to place the 4 electrodes. You're going to have 2 on each side of your back, about 2 inches apart on each side, like that. And we're going to go on the other side. Alright, so that will be the placement there. And once you have those placed, ensure that maybe your significant other or one of your kids, someone that you live with, ensures that all the electrodes are completely flat on your back. And if they're not, you can take some medical tape and tape down the edges because we want to make sure that there is full contact on the skin with the electrodes. Next, we're going to take your at-home TENS unit that you can open up like this, and we are going to set it to 100 for the pulse width, and we're going to do 100 for the frequency as well. And then we're going to take 1 channel for each side of your back, and we're going to place the wire into the electrode there, and this wire on the same side up here, and we'll take that other channel and place it on the other side. Okay, great. And then what we're going to start to do, you can have your significant other or whoever you live with give you the electrode pack, and what you're going to do is start to turn up one side at a time until you start to feel the comfortable level of tingling on your back. So you'll just start to twist this knob until you feel it, and then you'll go to the other side. And I want you to do this twice a day, 7 days a week, for about 30 minutes at a time to help with that pain relief, okay? And then once you're done, I want you to make sure that you turn the unit completely off, and then you can remove the electrodes and place them back on your plastic sheet so they last longer. And then you'll be done.
Let me know if you ever have any questions.